Involving mental health service users in care planning is central to NHS policy and important for health outcomes and recovery. But research shows it doesn't always happen, and this can leave service users and carers feeling excluded and unsupported by mental health services. EQUIP, a team of researchers, clinicians, service users and carers from the Universities of Manchester and Nottingham and Greater Manchester Mental Health NHS Foundation Trust wanted to bridge this gap between policy and practice. So in 2012, we secured a £1.9 million 5-year grant from the National Institute for Health Research to develop, evaluate, implement and disseminate a training programme for mental health professionals, co-designed and co-delivered with mental health service users and carers. We systematically reviewed the evidence on care planning and training involvement and conducted focus groups and interviews with 130 service users, carers and health professionals. What they told us about their first-hand experiences of care planning formed the content for our 2-day training course. Next, we enrolled 36 community mental health teams across 10 NHS trusts in England into a cluster randomised controlled trial and randomly allocated 18 teams to receive the training. The new training package was co-delivered by clinicians and service users and carers to 350 mental health professionals. Once the training was complete, we set out to measure the impact it had on professionals and service users and their carers. 1,286 service users with serious mental illness and 90 carers took part in the trial. Some were cared for by professionals who had received the training, and some were cared for by professionals who hadn't. They completed outcome measures before the training began and again 6 months later. We used the Healthcare Climate Questionnaire as our primary outcome measure. Secondary outcome measures were chosen by our service user and carer advisory group, based on the areas that might improve if service users were more involved. And because no suitable measure existed, we developed a new patient-reported outcome measure to measure involvement in care planning, the EQUIP PROM, an audit tool. We also asked professionals about how satisfied they'd been with the training and interviewed 54 participants to explore the organisational context affecting care planning. So, what did we find? Although health professionals were positive about the training, there was no difference in how involved service users felt in their care planning 6 months after staff had received the training, and no significant differences between the intervention and control groups. The training also proved not to be cost-effective when compared to the cost of usual care. There were some real positives, however. Staff who took part told us they really liked the training, especially because it was co-delivered by service users and carers. They also said it had left them feeling positive and motivated to change clinical practice. So what can we learn from all this? While staff said they recognise the importance of involving service users and carers in care planning and wanted to do this better, they also told us it was hard for them to apply what they'd learned to their day-to-day practice due to limitations like lack of resources and time. So, if we want to improve service user and carer involvement in mental health care planning, we may need to focus on more than trying to change professional behaviours through training. To fully involve users and carers in care planning, it's likely that more resources, time and organisational commitment will be required. What happens next? Well, we're communicating our findings through a number of channels, including sharing our training with NHS trusts, writing journal articles and using social media and blog posts. We've also created patient-mediated materials, including animations and pocket cards containing useful information and prompts to support their involvement in care planning. Want to know more about the study and its results? Visit the website or follow us on Twitter.